Hi, this is Scott Ritchie, and this is Adaptive Pressure Control Series. So I'm going to start creating a series of videos related to adaptive pressure control ventilation. Now, what is adaptive pressure control? You might not be familiar with the term, however, you might be using a mode like this every day. And as you notice on the left-hand portion of the screen, you can see different brands of ventilators, and on the right, what is their adaptive pressure control mode. So example, if you use Drager ventilators, auto flow is your adaptive pressure control. Or if you're using a Puritan Bennett 840, your adaptive pressure control mode is volume control plus. So you probably are using adaptive pressure control daily in your practice. Now these videos, what they're going to show is I'm going to compare adaptive pressure control to volume control ventilation and pressure control ventilation. So with each video, I'm going to give a scenario. So various changes in pulmonary dynamics or patient interactions and conditions, and how adaptive pressure control mode is going to work or adjust during these changes, and compare these to what normally happens when you're using volume control and pressure control to show you the differences or the similarities with adaptive pressure control mode. Now, the first video is adaptive pressure control and what happens when there's decreases in patient's compliance. So you're going to have the same changes if there's increases in patient resistance or airway resistance, but for the lung model I'm using decrease in compliance. Thank you.
First, let's take a look at volume control ventilation. What is going to happen if I decrease the compliance? So my patient's compliance changes. What we're going to do is we're first going to look at my ventilator settings, and I have a tidal volume of 500, a PEEP of 5, and a flow rate of 30. So this is set a little longer inspiratory time of 1.2 seconds. And we look at the measured variables over here on the graph, you notice that my volume is 500 and my measured peak pressure is around approximately 16 or 17 with a plateau pressure of 15. And now what we're going to do is I'm going to change my compliance. So I'm going to decrease my compliance, and I'm going to decrease that to 30, and let's see what happens. Now what happens when I decrease the patient compliance, I didn't mess with the settings at all. My volume stays constant in volume control ventilation. However, my peak pressure increases. And you notice it increased a little. It went to approximately 25 centimeters of water. So this is what happens when compliance is decreased during traditional volume control ventilation.
You notice my peak pressure of 17, and here's my tab 2. I'm looking at my compliance is approximately 50, measured compliance of 46 in the top left-hand corner. That's gray. And what I'm doing, I'm just messing with my test lung, and I'm just change compliance, and it's a kind of snap or the release of the springs when I'm activating it. So it made my compliance look better, but it's actually worse. Now it's measured values 28. That increased my peak inspiratory pressure to 23. So as you notice, my tidal volume remains the same, approximately 500. However, my peak pressure is the same.
Now, pressure control ventilation. What is going to happen if you're using pressure control ventilation and the patient's compliance decreases? Now, these are my measured graphs right here, and these are my parameters on this side. And we'll first look at the patient parameters. I set up the compliance to pretty much normal compliance of 66 and a normal resistance during mechanical ventilation with artificial airway. And I have my ventilator actually set at an inspiratory pressure at 11. It's kind of an odd setting, but that's where I have it set. And a PEEP of 5 and an inspiratory time of 1 second. And when you look at the measured outcomes from these settings, I see my pressure is constant, which is 16, and that is just my inspiratory pressure over my peak. So that gives me a 16 centimeters of water. And my volume, I'm getting approximately 600 milliliters of tidal volume with every breath. Now what I'm going to do is I'm just going to change the compliance and make the compliance like a patient's compliance that has ARDS. And I'll decrease that to 25. Now my compliance, there we go, 25. And we haven't changed my ventilator variables at all. Let's look at my measured values. And first, look at my pressure, it stays constant. And what happens on my volume side, as you notice when I change my compliance, my volume decreases dramatically. So this can lead to hypoventilation and respiratory distress. Pressure control ventilation. And if we look at the controls, I have a pressure control 11, respiratory rate of 10. And we get measured values, peak pressure of 16 and a tidal volume of 700. And now let's look at my patient values. Normal patient, I have a compliance of 66 and a resistance of 9. I'm just going to change this to change it like a ARDS patient, which will drop my compliance significantly. So you notice I changed it to 20. The compliance changes to 25. Let's look at the measured values. So my peak value remains constant, my peak pressure at 16, however my tidal volume is dropping significantly, which will also decrease my expiratory minute ventilation. Now let's look at adaptive pressure control ventilation. And this is a different kind of simulator. This is my adaptive pressure control simulator that mostly shows lag time and what happens when there's changes in compliance. So what I'm going to have constant is I'm going to have my patient variables. I'm going to start with a starting compliance of 66, making it pretty much a normal compliance. That's approximately the ideal body weight setting 1. I'm targeting about 10 cc's per kilogram of ideal body weight. My ventilator settings are a frequency of 10 and a tidal volume of 700. And we're going to look at the graphs. Here's my output measured variables, but I already plugged in my compliance change. So what I did is a compliance change of 40% of the original. So this is going to drop my compliance to approximately 25. So close to ARDS. And this is what's going to happen during adaptive pressure control. So let's switch to my graph here. And what we're going to look at is this first graph, what happens when my compliance decreases. And this is actually a dramatic decrease in compliance, like if it went right from 66 to 25, which will not happen at all. This is more in surgery. I was trying to demonstrate the pneumoperitoneum. And what we can see is, here's my measured values. And what happens the first breath, if there was a dramatic decrease, my measured tidal volume would only be 420. So what happens is the ventilator is going to have to increase the pressure and to get the desired output tidal volume of 700. So as you notice, the next breath, it's going to go up again. So here's breath 2. This was the first breath after the decrease. And then the next breath, I'm going to have a volume of 499 or approximately 500 because it's only increasing by 2 centimeters of water at a time. That's going to measure in. It's going to give another breath. And then I'm going to get around 658. And then my next breath, I'm going to get 737. And it might just stay at this, and it probably will not give another breath. So there's a lag of about 5 breaths before I actually get back to my tidal volume target.
Here is my adaptive pressure control mode. It says CMV plus, but it's actually adaptive pressure control. And you can see my settings of 700, respiratory rate of 10, my IE ratio. So I'm trying to target my tidal volume of 700 cc's. Here are my settings, and here are my measured values. So you notice my peak pressure is 16, and I actually have a measured tidal volume of 700. So we're matching right now. I'm going to look at my patient. We have it on normal patient. I'm going to just switch this to a ARDS patient. So with my normal patient, you see my compliance is 66. And when I switch it to ARDS patient, it's going to drop the compliance dramatically to 25. Now we're going to see what happens after the switch. We look at our measured values, and my tidal volume dramatically reduces. So what happens is the ventilator is always looking at this exhaled measured tidal volume, and it's going to adjust my pressure control or my pressure level. So we're looking at the pressure waveform. You'll see it starting to rise. And we can also look at the measured pressure value, and it's increasing right now. It was 16, went up to 19. And it's going to continue to raise my pressure until it gets the target tidal volume of 700. I'm just adjusting my alarms now. Or it'll adjust until I get to my pressure limit. So it keeps on adjusting the pressure control up. And now we're hitting my pressure limit, so I should get a pressure limitation alarm here. And this is usually around 5 to 10 centimeters of water below my high pressure alarm setting. And if you look at my waveforms, this red line is my high pressure alarm setting. So it's limiting how high the pressure can go based on that setting.